I'm Dr. Larissa. Now, a really important subject, again, a condition that lots of women may suffer from, is polycystic ovarian disease, and you might have heard that term used quite commonly. Polycystic ovaries are essentially ovaries containing lots of follicles, so it's a bit of a misnomer actually, because these follicles are not cysts. They are small fluid-filled structures which have the capacity to contain eggs. But the problem with polycystic ovaries is that these little follicles haven't quite developed properly. And that's because there's essentially an imbalance in the sex hormones going on within the body, meaning that women tend to have raised testosterone or male hormones, and that gives them sometimes symptoms such as increased body hair that you might find on the face or the arms or the chest, and more oily skin. So these are things that can visibly be seen and that could be noticeable. But the main side effect of polycystic ovaries is irregular periods. So sometimes these periods can be so infrequent that they don't actually happen at all. And one of the side effects of that is that the lining of the womb continues to build and build and build and not shed. And this is where that can start to cause a problem. So it's really important that if you suffer from this condition, you have input from a specialist or a GP to help you to manage it. The other thing that women find when they have polycystic ovaries is that they tend to more easily gain weight. And if you are obese or have a BMI that's over 25, the trouble is that this can interfere with ovulation because it starts to interfere with the hormones. And simply by trying to lose weight could help you to overcome some of this and can help to improve the chance of spontaneous ovulation occurring. In addition, women with polycystic ovaries have a slightly higher risk of miscarriage, and they can also suffer from things like mood swings and depression. So it's a really important condition to recognize and then to treat. So how do we recognize it aside from the symptoms that you might have? Well, your doctor can do a series of blood tests to have a look at your sex hormones and other things within there that can give us a clue as to whether you might have this particular condition. And then the other investigation to do, which is really vital here, is an actual internal scan or pelvic ultrasound scan, which looks and assesses the ovaries in details to see if it has got all these little follicles, which are typically found in what we call a string of beads appearance. So we look for all of those things and can also examine blood flow to the ovaries, which again can give us a clue as to whether you have the condition or not. Now, if you do have it and you're trying to get pregnant, there are a couple of things that can be done to try and help you. The good news about this condition is that you will have a good ovarian reserve. So you will have lots of follicles, all of which potentially have some capacity to have eggs. So that's the good side of it. However, it doesn't mean that these eggs are necessarily all viable or mature eggs or eggs that are capable of fertilization. And sometimes a helping hand might be needed in order to try and help you to ovulate, or to try and allow for fertilization to happen. So one of the first things that you can actually do yourself is to look at your diet, look at what you're eating, and I've got loads of tips about how to improve this and what you should and shouldn't be eating with polycystic ovaries under my nutrition section of the website. So I'd love you to have a look at that. Exercise is also really vital here. That's important because it will help to lift your mood and improve your energy levels, but also really vitally, it will help to get your body mass index to within the normal range. And in this condition, that is just so crucial, because just the very act of reducing your weight could help to regulate your hormones and could help you to ovulate a lot better and have more regular periods. So I really want you to focus on that. And again, there's some really simple exercises and tips that I give you in my fitness section of the website that I'd love you to have a look at and try and incorporate into your daily regime. Complementary therapies might also help, so things like acupuncture and counselling with a condition like this, which can also leave some physical marks. As I've explained, sometimes women can get unwanted or excessive hair growth that can be quite embarrassing and difficult to deal with, and so seeing a counsellor can help with that. But what can we do medically to help? So we can start off with some basics, which includes drugs like Clomid or tamoxifen. So these are drugs that can be given that act on the brain to try and improve ovulation within the ovaries. There's also another drug called metformin, which can be given by your GP, which helps to improve weight loss. But the other important thing with metformin is that it also helps to improve insulin resistance. So this is important because this is another feature that's found with polycystic ovaries. It means that essentially you have more circulating insulin around because it's not recognized to do the job that it needs to do. And this is again what essentially leads to some hormonal imbalances and increases your predisposition to weight gain. So metformin could help you to tackle some of that, but the most important thing to help with that insulin resistance is your diet. And again, there's lots of tips on how to address that and work with that under my nutrition section. Ultimately, if drugs like metformin, Clomid or tamoxifen are not working, then it might be appropriate to look at options like IVF. But you must discuss this with your specialist in terms of whether that's something that you could potentially benefit from or not. And ultimately, there is also surgery that can be done to try and improve the state of the ovaries. So things like a laparoscopy keyhole surgery that involves ovarian drilling, or essentially buzzing the outside core of the ovaries, which is quite hard, to try and improve the chance of ovulation. But again, these are all things that need to be discussed with a specialist before they're undertaken or before any sort of recommendation to do that is made. But the main take-home message here is that I want you to realize there's actually lots of things you can do yourself just by looking at your diet, looking at your fitness levels, and looking at potentially just overhauling and changing your lifestyle that could help you to conceive without even possibly needing any treatment. So I hope this information has helped. Please leave me any questions that you might have, any tips that you might want to share with others, and I'll do a follow-up video in the near future for you. Thanks for watching.